We recognize the opportunities that AI has provided. It is loosely regulated usage and prior authorization that is my concern. In fact, in March of 2025, the AMA uncovered that over 60% of physicians are concerned that the expanded use of AI in prior auth is exacerbating the rate of incorrect care denials, over 60% of doctors. Given this concern from physicians, do you feel that AI should be leveraged in the AI prior authorization decision-making process? And if that answer is yes, what guardrails should be put up?
Thank you for the question there. So definitely in the case of prior auth, I think that right now at Clover ourselves, we do not use AI in any form within the prior authorization process.
But are you aware that many Medicare Advantage plans utilize and Medicaid managed care plans do as well?
Absolutely. And I think that from our position, they should not be used in any kind. AI should not be used to review, to deny in any case. Like, that is not a good use of AI. I do not think AI is ready to do that right now, which is, I think is the problem you're addressing. There are use cases where it can reduce burden, accelerate getting to yes faster. Those are good places you can use AI, but not to deny care.
Do you feel that if AI does cause a denial or refusal of care, that there should be a person-to-person, a physician-to-physician evaluation?
Absolutely. A peer-to-peer is always appropriate, and that should be in all cases, maybe not even in denial if requested or if appropriate. A human clinician should always be the one making those decisions.
Thank you for your comments. Madam Chair, my time has expired, and I yield back.